I'm Dr. Shi Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this segment, I'm going to be going over the conclusion of Mental Health Awareness Month. And in this portion, I'll be talking about some of the symptoms, which are red flags for understanding more about the mental illness that you might be going through. So, first of all, let's talk about some of the signs that might alert you about mental health. Or if your loved one is going through this, then these are signs to look for. And so, the first thing that you want to look for is excessive fear or worrying. And people that are worrying too much, then there might be some mental health issues going on. Feeling excessively low and sad, confused thinking, or problems concentrating or thinking. And of course, I went over that when I was talking about ADHD, attention deficit hyperactivity disorder. And then extreme mood changes. Of course, that's a very classic sign of bipolar disorder. There might be uncontrollable highs and euphoria, and then some lows as well. And then prolonged, strong feelings of irritability and anger. So those are the top five things to look for when you're looking for mental health disorders. I also wanted to go over and summarize some of the mental disorders that I went through this month, including obsessive compulsive disorder, depression, anxiety, post traumatic stress disorder, and something that is overlooked often, known as, of course, eating disorders, bulimia, anorexia, things like that. And I even went through something different known as diabulimia, which is somebody who has diabetes and withholding insulin from that, or might be the opposite as well. So these are kind of, in summary, some of the different mental health disorders that we went over. Some assessment tools include the Kessler 6, KSL 6 mental health scale, which goes through some of the tests to ensure that to diagnose some sort of mental health disorders. And also the PHQ-9. I've done a lot of research in PHQ-9, which is great for diagnosing depression. There's 9 questions in the PHQ-9, and this gives you a synopsis of what mental health disorder is going on. So the problem with some of the mental health disorders is that they are subjective and not objective. So there's no gold standard. Like for instance, if you're thinking about some certain physical ailments, then you can, like if you do a biopsy, you can able to tell what is going on. Or with a brain cancer, you can tell what is going on somewhat. Although the gold standard is something else. Anyway, I was kind of going on a tangent, but the thing is that people that have mental health disorder, a lot of times they're also facing stigma and discrimination. So all of these aspects need to be understood if you really want to understand the effect of mental illness. So in summary, this is what we went over throughout the month. I hope this has made some sense. Thank you for listening.